backup materials. Okay. Matt and Paige Fiji were a happy couple with a 2-year-old already, and they were expecting twins. On October 18, 2006, Charlotte and Chase were born. It was a joyous time for the family, and both of the twins were born healthy. When the twins were 3 months old, however, the Fiji's lives changed forever when Charlotte had her first grand mal seizure. After trying multiple medical treatments and years of Charlotte suffering through multiple seizures a day, having her heart stop, and nearly losing her, they finally found a solution: medical marijuana. Medical marijuana was able to put a stop to Charlotte's needless suffering, and she is able to now live a normal life. Before treatment, she had suffered multiple seizures a day, and after treatment, she has maybe 2 or 3 per month. After researching the subject, watching a documentary, and reading several scientific articles, I have found that medical marijuana can not only help to provide a normal life to seizure sufferers, but it also has many other medical uses and should be legal in all 50 states. And there's a picture of Charlotte before treatment with marijuana and then after treatment with marijuana. I know that some of you may oppose this plan, but I ask you to listen with an open mind as we discuss the benefits of medical marijuana, the problems that patients face when seeking treatment, and then a plan that will help resolve these problems. First, let's explore the benefits of medical marijuana. Marijuana has many medical benefits. According to an article by David Noonan in the Scientific American, medical marijuana is not just for getting high. Scientists have discovered that cannabidiol, the compound in marijuana used by epilepsy patients, can be isolated and used without intoxicating the subject. Some critics say that legalizing medical marijuana may lead to abuse of the drug, but isolating the potential components that can help will actually take the risk of that down to 0. It does not intoxicate the patient at all. The benefits are not just limited to helping with seizures. Noonan goes on to say that marijuana can help with many other medical conditions. It can protect the brain from the effects of trauma and ease the spasms of multiple sclerosis. There is even research to support that medical marijuana can slow the growth of tumors, and it can also help repair the brain in Alzheimer's patients. Now that we've seen the benefits of medical marijuana, let's see some of the problems patients face when trying to get treatment. First, it's not legal everywhere. According to procon.org, only 23 states and Washington, D.C. allow the use of medical marijuana. This is less than half of the states in the nation. Even in the states where it is legal, there are cumbersome restrictions, and you may not be able to use it for your condition if it is not approved. Even if your doctor says that you could benefit from it, you still wouldn't be able to use it in the states where it's illegal. According to an article from thinkprogress.org, Angela Brown, a mother, treated her son, Trey, with medical marijuana. Trey suffers from traumatic brain injury, and he suffered multiple painful seizures a day. Angela tried a barrage of treatments, but medical marijuana was the only thing that eased Trey's suffering. Angela is now facing up to 2 years in prison for treating her son in a state where it is not legal. Now other parents are not treating their children for fear of prosecution, and other children are suffering needlessly. The extent of the problem is clear, and so too are its major causes, but what steps can we take to provide a solution? There are 2 major steps we can take to solve the problem. First, marijuana for medical reasons need to be legalized in all 50 states. This will allow patients the freedom to use the medical marijuana as their doctor sees fit. It will also save families the enormous financial burden of moving to another state so they can legally treat their child. Second, we need to ease the restrictions on current medical marijuana laws. In many states, medical marijuana is legal, but the restrictions are so cumbersome that it's very difficult for the patients to use effectively. If you don't have a condition that is approved, you cannot benefit from it, even if your doctor says that it's legitimate. Your doctor should be able to determine if you can benefit from medical marijuana, and if he sees benefit in it, you should be able to use it accordingly. So now you know about some of the benefits of medical marijuana and some problems patients face, and then other things that need to be done in order to help the problem. As of 2014, more than 100 families have moved away from their homes so that they can legally treat their children with medical marijuana. Other countless children and patients will suffer needlessly because the cure they so desperately need is not legal where they live. The issue may seem trivial to you, but think of little Charlotte and all of the other children whose misery could end with the proper legislation. If you care about these children, please contact your local congressman at www.contactingthecongress.org to help stop this needless suffering.